At the outset, I am thankful to all those people who are actively participating in this book introduction program. In fact, the reasons for the conducting this kind of introduction program to introduce you the importance of this book, why we have written, and also to whom it intended. Some of these questions we can answer over a period of time. Here, if you look at this one, this book is mainly focused on low carbohydrate, high fat diet regime. This is a new regime which recently come into work very much in the India and also in Andhra Pradesh. All over the world, there are significant problems as far as health is concerned we are facing. One is obesity, two is heart disease, and three is cancer. In India, particularly, we are a part of the same similar problems we are equally facing, just like any other country. In addition to the problems like communicable diseases, we have got equally non-communicable diseases and particularly lifestyle modification diseases like obesity and diabetes, cancer, and other part and parcel of metabolic syndrome diseases. Nearly about 64 components of this metabolic syndrome diseases are all closely related to the insulin resistance. In that connection only, how to tackle the insulin resistance and how to improve the insulin sensitivity, based on that one, the dietary changes. Here we are trying to introduce in this book low carbohydrate, high fat diet, so that through which we can change the insulin resistance mechanism and improve the insulin sensitivity and correct all the abnormalities what we are facing. For instance, whenever we take a refined, a processed carbohydrate diet, we are going to stimulate the insulin production at a higher level. This book mainly deals with low carbohydrate and high fat diet. Actually, this is in fact today's very popular diet to control many problems. That's what we are facing in a society. In the West, they started earlier these problems. Now in India, we are catching up. In the obesity, we are catching up for diabetes and also cancer and heart attacks. To deal with this one, unless we change our lifestyle and also modify our dietary conditions, probably we cannot address completely this problem. In the process, diet is one of the important aspects to change our lifestyle modification, apart from exercise and stop smoking and meditation and yoga and controlling the environment, toxic environment. These are the 5 pathways in which we can change the lifestyle modification, of which the diet is one of the very important. Diet includes the fasting too. So in the same process, we want to make every man on the street to understand more about this one. We have written this book. This book explains clearly the origin of the low carbohydrate, high fat diet and the need for the low carbohydrate and high fat diet in the control of several diseases, which include the metabolic syndrome. We all know that one metabolic syndrome is a complex and heterogeneous group of diseases, but at the same time, the one common thread for all this one is insulin resistance. Usually, whenever we eat some sort of a carbohydrates, particularly the high glycemic index carbohydrates, the insulin will be secreted inappropriately. The examples of high refined and processed carbohydrates stimulates maximum amount of the insulin, and when the insulin is inappropriate and all the carbohydrates will be converted into energy or a storage part into the glycogen, or they may push into the fatty tissue and they get deposited as adipose tissue. So in view of all these things, over a period of time, the insulin inappropriately is secreted and the cells once they are full of the glucose and they offer resistance and adaptation process occurs. In the process, you develop insulin resistance. When insulin resistance is high, its inability to push carbohydrates into the cells to convert into the glycogen or convert into the energy. The only part that is left over at that time will be converted into fatty acids and will be deposited into the adipose tissue, and that results in overweight, and also that results in a marked obesity. When once the obesity and the marked weight consistently present in a significant number of years, many people will develop diabetes. Once the diabetes and obesity, and in addition to that one like a smoking and sedentary work combined, all these things enhances the possibility of the heart attacks. And similar situation, the obesity and insulin resistance, high carbohydrate will precipitate the cancer too. So to address all these problems, particularly the insulin resistance, to control that one and improve the insulin sensitivity, the diet is one of the clearest modality in which we can alter this mechanism to our favor. When we control the carbohydrates to the lowest extent, like 5% to 10%, when opposed to the current practice which we are consuming carbohydrates at the rate of 60 to 70%. Now in a modern altered diet, we want to reduce the carbohydrate consumption to 5 to 10%. Similarly, previously we were taking the saturated fats at the rate of less than 5 to 10%, but now we want to increase those saturated fats to the 60%. The remaining proteins, particularly like the average whatever that we used to consume earlier, the same will be continued even in this diet without change in protein content. When once we realize diet is one of the important factors to modify the metabolic syndrome, several regimes were introduced all over the world. For example, like a paleo diet, like vegan diet, plant-based diet, and the like keto diet, low carbohydrate, high fat diet, and fasting, intermittent fasting, and more recently like a fasting mimicking diets. Like that, several diets were introduced, but out of all these things, one of the successful diet program after Atkinson diet is low carbohydrate, high fat diet. In a nutshell, if you want to understand the philosophy of low carbohydrate and high fat diet, the major problem here is the insulin and insulin resistance. So the simple principle, we start consuming the foods which have got a capacity to produce minimum amount of insulin. For example, like a fats, they will not stimulate any amount of insulin when compared to the carbohydrates and proteins. The worst part in insulin production is shared by the carbohydrates, particularly refined and processed carbohydrates. The proteins stand in between carbohydrates and the fats. Initially in Atkins diets, there is significant improvement they noticed after cutting down the carbohydrates and allowing them to eat as much as proteins and increasing the quantity of the proteins. It suffered some drawbacks, and ever since they keep on modifying after knowing the pathophysiological states of a modified diet. Now, after several experimentation by several investigators and a research scientist, after studying good number of years, they confirmed low carbohydrate and high fat diet is one of the solutions for many problems what we are facing. In that process, we introduced this book so that we can follow in a simpler manner the low carbohydrate and high fat diet. And also initially in the first few chapters, we are given the concept of low carbohydrate and high fat diet, and also what are the major contributions by the macronutrients like carbohydrates, the proteins and fats. And also we described about the metabolism, how they are going to metabolize once we ingested from the diet. Similarly, we know that the carbohydrates, once they consumed in an excess amount more than body can consume in terms of energy, all they will be deposited under the influence of the insulin as adipose tissue and fat. So we know that all these things are mediated to the insulin. As long as insulin secretion is high, it will not allow to burn the stored fat. Unless the insulin levels are very, very low, the stored fat will not be utilized for the energy purpose. So, we are mimicking a diet in which we do not require any more large amounts of insulin by giving the high fat and cutting down the insulin requirement by reducing the carbohydrates. In the process, we do not want to change anything about the proteins. Whatever the proteins proportion, we want to retain the same amount of protein in this particular diet. To introduce this one earlier, we had a significant drawback, that is saturated fatty acids are one of the irresponsible cause for the heart attacks. So, for the last 6 decades, the popular diets consist of low fat diet and high carbohydrate diet. In spite of cutting down all the fats, instead of reducing heart attacks, in the contrary, we increase the proportion of heart attacks, and frequency of the obesity and the frequency of overweight has significantly increased all over the world. Then we have to look back again the theory of low fat and the high carbohydrate diet, how far it is healthy in the given circumstances. When we look back and also with the new evidence of research, we understand that only when you combine the carbohydrates plus saturated fats, we are getting the bad component of the bad cholesterol. And also we know the bad component of the cholesterol is derived from the carbohydrates, particularly refined and processed carbohydrates, whereas the good component like HDL cholesterol is derived from the diet what we are taking with a saturated fatty acids, particularly animal fats. That is the reason why to improve the good cholesterol, we are enhancing the part of the good component of a saturated fats and healthy fats like animal fat, and also the plant-based healthy fats like coconut oil. These two things will improve significantly the HDL content of our blood chemistry and protect the heart attacks. Once we know this one, then we know how to tackle with the insulin resistance by reducing the carbohydrates and also protecting the bad effects over the heart by increasing the HDL cholesterol through the coconut oil and also the saturated fatty acids. Particularly like previously we strongly recommended yellow of the egg to be avoided. Now without any fear we can consume significant of yellow of the egg along with the white, and also we can increase the number of eggs. Unlike previously our recommendations were 1 egg per week. Now we can relax that one, we can take significant good number of eggs per day. Similarly, previously the animal fats, particularly chicken and in the red meat and all these things like fish and in the prawns, which were avoided with the fear of cholesterol, now can be recommended strongly. In the absence of carbohydrate intake, one can increase the saturated fats, particularly healthy fats we can increase, and also we can cut down unhealthy fats, particularly the unhealthy fats will come from the refined oils, plant-based refined oils like sunflower oil, canola oil, safflower oil, peanut oil. All these things will contain refined processed oils, will contain a disproportionate ratio of omega 3 and omega 6. When once the omega 6 is entirely different, so we have to control all those things, and we can improve the healthy fats and we can control the bad cholesterol part by controlling the refined oils, unhealthy fats, and also cutting down the carbohydrate. Right, in this way we got enormous confidence. We can increase the saturated fats and we can improve our health as far as the cardiovascular disease are concerned. Similarly, the obesity will be controlled when once the carbohydrates are cut down, and at the same time we do not lose the muscle mass because we are taking up 1 gram protein at least for the kg body weight of the lean body mass. So we are able to retain the muscle mass without losing its integrity, and we can improve our body stature by cutting down all the fats. In the process, what is required for an average person is to have to improve the understanding from where they are getting good fats, from where they are getting bad carbohydrates. One has to understand the macronutrients in a day-to-day given the foodstuffs, particularly like a rice and wheat and all the grains, including the millets and all those things will contain significant amount of carbohydrates. We want to cut down all those other things. Similarly, like pulses or legumes, like the lentils, all these things will contain not only the proteins but also the amount of significant carbohydrates. So we have to forego even those things in this modified diet. So basically the grains in every type of grain, and also the products that are derived from the grains like atta, like rice flour, like wheat flour, and all those things we have to avoid. Similarly, all the pulses, legumes, all these things we have to cut down. So in the net result, what we left over is particularly plant-based, all the leafy vegetables. They are good, which contains a minimal amount of carbohydrates, maximum amount of proteins, and other situations. Similarly, all the healthy fats are coming from the animal base like eggs, and also animal base like chicken, and white portion like particularly the wings rather than the legs, and similarly red meat like lamb and in the goat, and etc., etc. Even including the beef, they contain a good saturated amount of the fat. So we can enhance the saturated fats and decrease the low carbohydrates once we know all the items which one contains the healthy fats, which one contains the bad carbohydrates. So in that process, for an average person who is not fully aware of each content of each food item what we are taking, we introduced in this book nearly about 250 items, what are the composition, particularly macronutrients and also micronutrients like the zinc and minerals, and also we have described for each 100 grams of each component of this diet will contribute how many calories, so that we can reduce the calories, we can reduce the carbohydrates and enhance our fat content, at the same time remaining the protein content as it is whatever that we are taking earlier, so that we can choose intelligently based on a nutrient value of each product. All these pictorial images were given a star rating too, so that for a easy identification, even in a hurry, they can scan through without going through all the nutrient value. Just for example, like a 5 stars, they can safely use because it contains the minimal amount of carbohydrates. Similarly, even the star rating 1, if you are going to use a small quantity like turmeric, though it contains the high amount of carbohydrates, but the usage of turmeric is such a small quantity that makes it convenient for the person to choose comfortably, and also within his own limits of 20 grams he can choose various items and he can decide which food is the best. In that way this book helps quite a bit. And also this gives a guidance and also proportions, like for example carbohydrates has to be reduced to 20 grams and proteins about 20 to 30 grams for an average individual, at the most maybe 40 to 50 grams, and the rest of the grams and calories should be acquainted from the saturated fats. In that way one can design based on these pictures, based on the nutrient value, one can design the food items, and a whole day they can plan comfortably, and also they can change the choice of foods choosing the number of carbohydrates what they are taking. That's the reason why we have given wide variety of food items, so that they can get the best of best out of that. Similarly, there is in another chapter we are giving all the guidance how to initiate, when they reach a plateau what to do, and also after attaining certain goals what best they can do to control the further in the maintenance phase. Initially we are reducing the carbohydrates to 20 grams, but once they attained this kind of a situation and a stability, and also in the maintenance phase we can enhance the carbohydrates to 40 grams or 60 grams, depends upon various blood tests. And we are recommending strongly for all the people to undergo, before start the initiate program, to undergo significantly a scan of all the organs and also various tests of a blood test, so that we know we are dealing with what baseline. And also after changing this diet, we will be reassessing their blood chemistry and comparing with the previous results, and if any kind of deviations are there from the normal or very abnormal, we can have a better control on those things based on their blood chemistry tests. So in that way these are all helpful, and we can understand how best that we can get over a period of time, and we can stabilize their program. Once they reach their goals, we can take them to maintenance phase for a rest of the life, in which they can get the best out of this one. This book is only a simple guidance and simple awareness program, rather than one should not start after reading this book on their own the treatment. If once they do that one, probably they will face a lot of ill effects. Just like in internet, so many things are available knowledge about every disease. Even this metabolic syndrome diseases cannot be controlled by knowing one book or a one diet schedule. One has to undergo the before and after the adequate test, and with a knowledgeable person, if they can get guidance, probably they can get the best out of this one. And also, to give some extent, we have given some formulas how to calculate the basal metabolic rate, how to calculate BMI, how to calculate the fat content in their body, so that they can keep a monitoring, close monitoring, how much the fat they are losing, how much lean body mass they are losing, and how much the BMR before and after, and also BMI, what is there before and after. All these parameters to help them, an average person, to stabilize, to control, and to maintain a healthy situation. I think this book is immense helpful for the people who are starting this low carbohydrate, high fat diet, and also to maintain in that same given good condition for a longer time. In that way, this book gives you enormous information regarding the nutrients, regarding their values, and regarding their usage. And also we have given in a nutshell form what type of a diet they can do in a weekly planner. We have given some sort of a average planner. One need not stick to that. It gives an impression how best they can control their diet in a weekly basis. Once they are comfortable, they can interchange with this kind of a program. They can rewrite their own schedules, and they can follow of their comfort. Similarly, we have introduced the concept of fasting, intermittent fasting in this book, and the advantages of the fasting, how best that you can derive the maximum benefits with the fasting, block fasting or intermittent fasting, or with some kind of a fasting mimicking fasting diets like MFT. How best that we can derive, we can easily plan once if they know these planners. So in that way, even for a busy scheduled person, one can have a glance at that one. They can decide on a particular day what sort of a lunch they can have or what sort of a dinner they can have. They can easily choose instead of worrying about what to eat. In that way, they can choose from the wide spectrum of the menu. Similarly, we have given lots of knowledge about the macronutrients. They can choose the ill effects of that one and also favorable effects based on the theoretical background. At the end, in the last, we have given lots of reference books so that they can gain new knowledge from the reading the original books, original authors, and also original work from which we quoted all these things can be get easily. Accessibility is there because we have mentioned all those references at the end, and anybody who is interested more than what we are getting the information, they can get this information from those reference books and they can update their knowledge. Thank you very much. This book helps you certain guidelines and gives a broad direction, but it will not tell you a customized way what type of a diet one person has to follow. If somebody wants to follow strictly for his conditions, he has to undergo the blood test, and also he need a supervised guidance from the qualified doctors. Without that one, by reading book and having some knowledge, if they start practicing and start treating their ailments, they may end up in disaster results. That's the reason why we are strongly recommending for everybody to undergo certain blood tests so that we know what to control, how to control, even when some abnormality occurs. So that this knowledge helps to what are the various basic tests and how to modify that one. For example, like insulin resistance, we have to modify and we have to titrate. Similarly, like a dementia, for that one the dosage like coconut oil will vary when compared to the control of the diabetes or a control of the weight has got a different dosages, and control of the dementia has got a different role. So one has to assess what condition they are having and what parameters they are measuring. Based on that one, we can give a customized treatment to that particular individual. These are only averages. Many people may not fit into the averages and they require a special attention, just like a tailor-made shirts, which are required for that one, so that we can do the tailor-made shirts only we can do by means of blood tests. After analyzing, after interpreting the blood test, only then only we can give a intelligent advice to the person who is seeking to implement this particular diet program. And also having decided to use this one, and also these blood tests will give a guidance for them to continue, how long to continue, and when to shift to other parts of the diet are all decided by the blood tests. Unless they know, for example, like a serum ketone bodies. Unless we know the serum ketone bodies, there is no way that we can assess somebody is without ketosis or nutritional ketosis or a starvation ketosis or ketoacidosis. There are so many stages in ketones, and only we know after testing repeatedly and also comparing the previous results, then we can assess in which stage he is and how best that he can utilize the benefits of this one based on these blood tests. So in this way, the blood tests are very, very important before and during the process, even afterwards, to maintain and in a stable health. One of the main key issues in the low carbohydrate, high fat diet will be taken by the coconut oil consumption. Coconut oil is a unique in this low carbohydrate, high fat diet. The reason for that one is it contains the medium chain triglycerides. Medium chain triglycerides directly gets absorbed from the coconut oil to the liver, from stomach to the liver, and they will be converted to ketone bodies. Once they are converted directly without wasting any kind of a time, the moment you ingest, you take the coconut oil and they will converted into the liver by the portal circulation and immediately. Whereas the olive oil, whereas the ghee or butter, they are long chain fatty acids. So they will take longer time going into the intestine, and from there they have to get absorbed into the lymph and then come to the liver at the end. So there is a time delay between the other long chain fatty acids and medium chain fatty acids. And also another most important thing is the coconut oil composition is very close to the human breast milk composition. It contains the same amount of saturated fats and also same amount of percentage of saturated fats and also the medium chain triglycerides. Both are there uniquely in coconut oil and also the breast milk. That's the reason why it is very, very close to the nature, and we have to take heavily dependent on coconut oil. And also the coconut oil, the dosage is variable between the disease, between the state of body like overweight or diabetes or dementia, and also for the treatment of a cancer. This significantly it varies, depends upon the original condition for which we are prescribing the coconut oil, for which the blood tests significantly give a direction for us how much dose to be given, or even the dose variations, how to best that one modify over a period of time based on these blood tests. Once the many people start low carbohydrate diet, the constant problem that comes to their mind is when they can go back, when they can switch back to the original high carbohydrate. The answer is very, very difficult, because the once in a long duration when they consumed high carbohydrate diet with low fat, they got into the problems of obesity, they got into the problem of diabetes, they got into the problem of all other metabolic syndromes, patient like thyroid, like PCOD, like etc., so many other problems. The root cause for that one is high amount of carbohydrate. Suppose after attaining certain about stability, if they reverse back to the again to high carbohydrate diet, again you are inviting the same problem again and again. So instead of that one, we can do a blood test. At the most, how much of relaxation we can give to the consumption of the refined or processed or a complex carbohydrates, instead of simple carbohydrates, complex carbohydrates like the fruits, like the legumes, like other things like a brown rice. And these are the one complex carbohydrates instead of a simple carbohydrates which is available in white rice or the wheat, and those things we can avoid. And at the same time, we can take some kind of a complex carbohydrates, we can escalate the carbohydrate content, and we can enhance the comfort food in our diet. But again, there is no time specific for this one. It varies from individual to individual, and also based on the metabolic situation and also the pre-existing disease condition. For example, if you take the diabetes, a 20 years diabetic patient behaves entirely different a 2 years old diabetic. So, the onset of diabetes and how many years they suffered because of that diabetic metabolic problem, it all decides how quickly he can go back or how quickly he can sustain in the maintenance phase. And the duration of a positive benefits also take longer time, and also going back also takes longer time. So, one has to decide based on their individual criteria, but in general most of the diabetic people will be controlled within about 3 to 4 months, and also most of the people will lose the weight to the ideal weight. This does not reduce the weight or it does not increase, and it depends upon the condition. If somebody is an overweight person, it will improve towards the ideal weight, it optimizes. Similarly, underweight person, it improves to the optimizing the ideal weight. So, underweight person gains weight, overweight person loses the weight. So, in that way the diet is only optimizes the weight, but neither increase nor decrease. Though the most of the people are using for weight reduction, they may think that this is the diet for weight reduction. In fact, it is not a weight reduction diet, it is a weight optimizing diet. So, in that way one can use based on their goals. Again, ideal weight may not be the ideal for everybody. It is what we have to achieve for this one is healthy weight, healthy situation. Even though they may be 2-3 kgs this way or that way, it is not going to make a big difference as long as they maintain their health parameters well, and also they are feeling comfortable and they do not have any kind of major issues. Then we call that one healthy weight for that particular individual. There is nothing like an averages, there is nothing like a uniform formula, and one has to be customized every need of that particular individual.
Frequently, lots of people are asking why in 3 languages. Initially, we have written in Telugu only. Subsequently, we included in Hindi and English also, so that we can reach to majority of the population in our country. And also, food items are identified if we read in our own language. That is the reason to include in 3 languages. In women, PCOD, irregular periods and thyroid are the common problems. Overweight and insulin resistance are related to these problems. If we follow this diet, these problems can be addressed, and also overweight, PCOD and irregular periods can be cured.